Hi, everyone. Sorry for that slight pause. It is a pleasure to be with you today. I am Vanessa Carey. I'm the CEO of Seed Global Health. And I'm actually also very pleased with you today because this has been a very big week for us. Seed Global Health just opened its applications for 2014 to accept new doctors and nurses to be a part of our program. But we also just changed our name from the Global Health Service Corps, which is what you're probably seeing in your program, to Seed Global Health. And we did this because we think it better captures our mission and the full scope of our work. What we do is we cultivate stronger, sustainable health systems around the world. And we do this by sending doctors and nurses abroad to be faculty, teachers, trainers, to help build capacity. And the idea and hope is that one of these doctors and one of these nurses can have a very exponential power because they can train one more doctor or one more nurse and so on. And you can really see sort of the seeds will grow through the years going forward. It was a little bit over a year ago only that we actually launched an innovative public-private partnership with the Peace Corps and PEPFAR. And it's called specifically the Global Health Service Partnership, which is part of the reason we changed our name. Seed Global Health's role is really to play the expert sort of technical capacity partner and to help provide loan repayment to these volunteers to enable their service. And what we've effectively done is help create the first federal program for international service, and in many ways we think how the U.S. engages in the world. We maximize the benefits, though, of a public-private partnership to be able to ensure that Seed Global Health as the private partner can continue to act nimbly and quickly when needed. And we do this, for example, we're working with Exxon as one of our corporate partners to help provide loan repayment to these volunteers. And our partnership with Pfizer is going to allow us to do monitoring and evaluation so that we can follow these outcomes and see where the program goes. Before we talk about what this solution that we think we have looks like, though, I want to talk a little bit more about the problem. The World Health Organization says that there's a critical shortage of 2.4 million doctors, nurses, and midwives in over 57 countries around the world combined. And what that means for a country like Tanzania is that there is 1 doctor and 24 nurses for every 100,000 people in the population. To put that in context, there are 240 doctors and 980 nurses for every 100,000 people in the United States. And what makes it worse is that Africa, actually the continent, has some of the world's highest burden of disease and some of the smallest amount of healthcare workforce to deal with that disease, and even worse, almost no funds with which to try to rectify that imbalance. And doctors and nurses are actually leaving places with the worst burdens of disease and not many healthcare workers for other places where they have better futures, better professional opportunities, better mentorship, and really the opportunity for careers and livelihood. And what that means is that those 24 nurses and that 1 doctor from Tanzania are leaving to go to the United States or Canada or Australia. And one of the most significant repercussions of these doctors and nurses leaving is that they effectively are leaving no one behind to train a new generation. And what the result of this is that there's a cycle of inadequate and depleted healthcare that just keeps getting perpetuated. And that students, 2,000 students in a classroom in Mali in 100-degree heat who can't read the chalkboard, who can't hear the teacher, are still going to stay and want to try to learn. I'm a physician, and I've seen what this looks like in many countries. I've seen these hospitals in Ghana, in Rwanda, in Uganda, in South Sudan. And I've seen the intensity of poverty in these places. And what you're seeing is that sick people only go to the hospital when they're very sick. They only go when they think that, there's nothing left to do. And frankly, they go to hospitals because they think it's where they're going to go to die. I actually became inspired to help find this solution for this type of problem when I was 14. And I had the opportunity to travel to Vietnam pre-embargo with my father. And while I was there, I saw a poverty and a destitute need that was so completely indescribable. And it's frankly carried with me ever since. It carried me through medical school, it's carried me through my master's in public health, and it actually carried me to a forum with the Peace Corps in October 2010 when I did something I'd never done before. I stood up and I asked an anonymous question of the speakers. And I asked if the Peace Corps would be willing to send doctors and nurses abroad as medical educators to meet the need and to provide more technical capacity, and the answer was yes. So I'm proud to say that this July, we're going to be sending 35 doctors and nurses to Tanzania, Malawi, and Uganda as medical and nursing faculty to help scale up the human resources there. The partnership with the Peace Corps works because we partner specifically with ministries of health and ministries of higher education in order to map out what the needs are in the countries. And then we work with the hospitals and the teaching schools themselves to figure out what are the exact kind of teachers they need. And in sort of a dorkier online version of dating or online dating, we actually match the obstetricians, the pediatricians, the ICU doctors with the exact sites they need them so that the sites get the kind of teachers and trainers. And we actually provide loan repayment to support these volunteers as they do their work. This year, we will help pay back over $700,000 worth of debt for our volunteers. I'm actually struck by the diversity of our volunteers. They come from all areas in the United States. Some are serving with their spouses. Some are actually going to serve without. Some are at the beginning of their career, and some are at the culmination of their career. One person who's towards the end of her career is Karen Jansen. Karen is a nurse who actually was part of the Peace Corps over 30 years ago. She worked as a public health nurse and then came back to the United States, settled in Houston, and has developed a teaching career working with at-risk populations. When she found out about our program, she decided to re-enroll, and she's going to be joining us next year as faculty at the Lyra School of Nursing. This is a school that is actually opening its doors only because of Karen and her two other colleagues. And it's opening its doors in an area in northern Uganda which used to be besieged by conflict. And the School of Nursing is now a symbol for the rebuilding of the region. Another example is Dr. Johnstone Kumwenda, who is a Malawian doctor who was trained by the Peace Corps when he was young and now is our partner in this program in Malawi. He used to work abroad, and now he's come back to Malawi to help build the programs and the teaching and the education there. And he believes that our 6 volunteers are going to make a huge difference there because he knows that each one of them is going to be able to keep teaching and training. We know that these kind of health challenges we can't do alone. We know that we rely on partnership. We rely on our partnership with Pfizer. We rely on our partnership with Exxon. And we are hoping that through the energy and enthusiasm of private sector businesses and corporations like all of you who have made the time to come and be a part of this conference, that we can continue to build partnerships that will make a difference, and that you will find other partners here for you to work with that will make a difference going forward. This panel is going to be, it's really a panel of people who are at the forefront of corporate volunteerism. And I'm very pleased to welcome Amanda MacArthur, the Vice President of the CDC Development Solutions, who is going to introduce the panel and the session. Thank you.
Hi, everyone. Thank you so much for staying with us on this beautiful afternoon. I would probably be sitting in the park if I were you, but thank you for coming. I think we have a really fantastic panel here. We really have leaders in the world of corporate volunteering and global pro bono, and I think we're going to have a really interesting conversation. Just really quickly, how many people here are familiar with international corporate volunteerism, the concept? Okay, so most of you, let me just really quickly kind of tell you how we define it, and I will also tell you who we is, because we are a little confusing sometimes. International corporate volunteerism are programs that send employees of usually multinational corporations, but any private sector firm, to work on skills-based pro bono assignments in a country that is not their own. And I think the 2 parts of that that are important are the cross-border aspect and the skills-based aspect. So we're actually engaging people's professional and technical skills in a new location, in a new way. These programs can be team-based, like IBMs, which we'll talk about in a little bit, or they can be individual, more fellowship-type programs like Pfizer's and BI's. So there's the way these programs look is really dependent on the goals of the company and of the needs of the beneficiary organizations. This type of program is growing incredibly fast. Since 2006, thousands of corporate volunteers have volunteered in over 64 countries. And it's really used primarily as a way to develop professional and leadership skills. So just real quickly, let me tell you who I am. I am a vice president at CDC Development Solutions. We are not that CDC. I always have to say that in a health context. We were launched in 1990 as a way for American citizens to volunteer their expertise, primarily in Eastern Europe and the countries of the former Soviet Union. We were launched as Citizens Democracy Corps. So that's where the CDC comes from. It is not the Centers for Disease Control. I think one of the things about these programs, and we currently run programs for about 12 multinational corporations, is that they're transformational. And they're not just transformational for one stakeholder, they're transformational kind of across the board. So for participating employees, they're provided with this incredible new perspective on the world. They get to use their skills in a new way and engage their leadership talents in a new way. They gain an opportunity to be culturally competent in a way that simply wouldn't be possible if they were at home. And they also kind of learn how their skills apply in a totally different environment. So if we're taking someone who spends their days working at a Pfizer research and development facility, and we send them to go work with a health organization in Kenya, they're going to really learn a new way of doing their job. For the organizations that benefit from this support, they receive access to skills and talent that simply isn't available on the local market or available at a cost that they can afford in the local market. So they are provided with an opportunity to either expand their the opportunities to serve their constituents or maybe do something completely new. And then finally, for the businesses, I think it's really important to keep in mind as well that these programs really have the potential to be transformational for business as well, not just in a traditional corporate social responsibility sense, but really in creating shared value and providing things like brand awareness and market knowledge, but also opportunities for lean innovation and really learning how to adapt products and services to meet these markets, which are the most critical markets of the future. So I know we're running a little late, so we'll jump right into our panel. I'd like to introduce you to Caroline Rowan. She's the VP of Corporate Responsibility and the president of the Pfizer Foundation. In this role, Caroline is responsible for Pfizer's corporate responsibility strategy and has led the transformation of the strategy to better support emerging business priorities. She is also influential in creating the One Report, which combines the annual and corporate responsibility reporting. In 2012, Caroline was selected as a David Rockefeller Fellow through the Partnership for New York City. Caroline, can you tell us a little bit about the Global Health Fellows Program as it enters its 10th year?
Sure, thanks Amanda, and thanks to GBC Health for hosting us and for all of you troopers to stay inside on this beautiful Friday afternoon. We're really grateful for the opportunity to talk about the program, particularly because it is our 10th anniversary year. The Global Health Fellows Program, affectionately known at Pfizer as GHF, was launched in 2003 and is an international skills-based volunteering program designed to provide our highly educated and skilled employees with opportunities to partner with NGOs working in the field. Since its inception, we've had more than 300 fellows out in the field in more than 40 countries. The value of that donation is around $47 million in US dollars, as well as about 365,000 volunteer hours. It's a program that we're so pleased to have a leadership role in, and actually the story of the program goes back to a CEO that we had in years past that felt very much that Pfizer could contribute much like the Peace Corps in solving for and addressing the HIV/AIDS crisis, and we'll be able to tell the story of its evolution on this panel today, so thank you.
Thank you. I'd also like to welcome Beth McGuire, who's the Director of Corporate Social Responsibility at Boehringer Ingelheim. Is it okay if I just call it BI for the rest?
BI. We'll just go BI from here on out.
She is responsible for the strategic direction of BI's CARES Foundation. And she also supports the Foundation's Patient Assistance Program, which provides select medicines free of charge to uninsured patients in the United States. In this role, she is responsible for driving BI's partnership with Ashoka in the US to increase access to healthcare. And she engages employees with functional expertise to participate in social enterprises through mentorship and other collaborations. You all have kind of a newer program.
We
so
definitely do.
Can you tell us about it, please?
I would love to. So our program is much newer than your program. It actually started as a way to celebrate our 125th anniversary back in 2010. And the company really wanted a way to look differently. We knew that the marketplace was changing. We knew the way that we were going to have to deliver medicines to patients, particularly those with low incomes, was really going to change. And we wanted a way to create a program that could bring more health to more communities and patients everywhere globally. And so we started then making more health partnership with Ashoka. Ashoka, we chose to be a partner of ours because they were very aligned with the key things that we were aligned with, which was bringing more health to patients. And really through this partnership, what we're hoping to gain is experiences for our employees that they can take back into their day-to-day work and really gain new insights and different thinking. So we're going to talk today a little bit about pieces of our program. In particular, we have a skills-based volunteerism pillar of the program. And in that case, we do things called virtual hangouts where employees can have a small taste of what it's like to live in the world of social entrepreneurship, as well as we have actually one of our executive in residence, Tom Frank, here with us today, who actually participated in a program where he did skills-based volunteerism in Argentina for 6 months. So we have a wide gamut of opportunities, and really the company felt strongly that this was a really, in the partnership with Ashoka, it was a really safe place for us to sort of test these things and hypothesize and really see what it was going to be like so that we can all start thinking differently.
Great, thank you. I'm also pleased to welcome Gina Tesla, who's the Director of Corporate Citizenship Initiatives at IBM. In this role, she's a member of the Corporate Citizenship Leadership Team and acts as a specialist on the policies and trends of corporate citizenship worldwide among NGOs, governments, and corporations. In her role, she also leads IBM's Corporate and Executive Service Corps, which she'll tell us a little bit about today. And Gina is a returned Peace Corps volunteer, so she has some firsthand experience working in some of these markets as well.
So I'm very happy to be here today, and I will echo all the thanks for being here and listening to us on this fine afternoon. And I'm thrilled to be able to be part of this program, particularly as a returned Peace Corps volunteer. It was very important to me once I came back and got my MBA that I worked for a company who shared my values, and I certainly didn't expect to be leading a program that would be so closely connected to my experience. The Corporate Service Corps program was created in 2008, and really our emphasis was to help foster employees who were better able to work in a globally integrated enterprise. And what's resulted is that since 2008, we've had 2,000 people who've gone through the program. Those people have come from 50 different countries, and they've traveled to 30 different countries and worked on 4-week assignments. And what's happened as a result is that we've really seen a triple benefit. We've seen a very strong benefit, certainly for the communities that we're serving, a benefit for IBM in the sense of learning more about the markets that we're working in, building relationships, enhancing relationships, starting to create a footprint. And certainly for our employees, it's been an exceptional way for them to have a very unique leadership development experience. But it's really gone beyond creating employees who are better able to work in a globally integrated enterprise, but has also created employees who really truly feel passionate about their company, because their company has really given them the ability to work on the ground and to help make some very significant changes. So we have our program is team-based, which is a little bit different, and one that we find is also a very strong benefit of the program is that the people who are together on these teams of 10 to 15 people from all over the world really get to build an extraordinary network across the globe as we look at the 2,000 people who've gone, as I said, from over 50 different countries. So it's a little bit about the program.
Great. Thank you. So you all are kind of several years into your program at this point, or a decade into your program at this point. What have been some of the challenges that you've encountered, and what have you done to kind of address them along the way? This is for everyone.
Do you want to start?
Go ahead.
So I think what's interesting is we've seen the program evolve from what in concept was very much designed to address kind of where Seed Global Health is today, which was we knew there was a healthcare shortage of workers, and we thought as Pfizer we have physicians, we have nurses, we have pharmacists, and we should deploy them, and we knew there was a great need on the ground, and this was back in 2003. And fast forward to today, what we found is, yes, we do have physicians and nurses and pharmacists that are very valuable to our NGO partners, but there's also need for the basic business skills. So business strategy, accounting, HR, expansion plans for our NGO partners. And so we've evolved the program to be much more targeted. We now work with only 12 partners. When we started, we worked with as many partners as we could, frankly, and it was a little bit unmanageable. And we also found that we weren't creating the impact. So for Pfizer, we've always focused on not volume, but impact. We want the impact on the ground, and we want the impact at the organizational level, and we want the impact at our colleague level. And so I think if I could say that there was a theme, it's been a tighter focus and much more of a sense of evaluating the effectiveness of the work every day that we're doing with our fellows. So those would be the two themes that I would see shifting from the original launch.
Yeah, go ahead.
In terms of some of the challenges, I think in the beginning, some of the challenges were really communicating the benefits to the managers who have to let these employees go for a month on the ground. They spend 3 months preparing, which is in addition to their day jobs. But I think as the program has been around now for 5 years, and we've really seen the strength of the program and the benefits that it imparts to the employees, that we have a lot of points of demonstration that managers can talk amongst each other, and we've also created an executive element, so some of those managers have gone on assignments themselves, and so that's one area that was a little challenging in the beginning. And then I think also some challenges that we have are working a little bit on expectations once employees get back, and really harnessing all of this enthusiasm that they have for community service, and you know, they really become superstars for 4 weeks. And I know that there certainly is I remember from my own experience, certainly one of the hardest things was really reintegration, and so those are some of the things that we're working on to improve that process.
And I think for us, some of the challenges, you know, we're newer at this, some of our initial challenges were, I think we as a company thought that this was going to be sort of an opportunity for all employees, and that, you know, we would announce the partnership and then everyone would start volunteering. And I don't think we realized at the time that it's really, you have to be selective, and it's not necessarily for every employee. It was also a hard topic for certain pockets of the organization to really wrap their head around. So it was a hard concept for them to see sort of the shared value, right? And they're used to producing things with short-term goals, and this is really something they need to invest in for the long term. And that, I think, has been a little bit of a hurdle, is trying to get people to see the value of this long term versus them wanting to check the box and sort of the short-termness of it.
And how do you all go about selecting the types of organizations that you work with, or the partners that you have on the ground, or if you're working domestically on those types of programs?
Well, I think the evolution of our partner selection has been a really critical element for us, and a real learning. We have high demands of our partners, frankly. We want them to be able to think about the impact of the volunteers' work over time, completely absorb that knowledge transfer, and ensure that we have the impact that we're seeking. So in that regard, we have almost an application process, and partners are apply, and then we review that. And we work with them and make a commitment to them for 2 years. And what's been great about the sort of more focused approach means we get to know them quite well, like GBC Health, and we have a number of our fellows in the audience today. So that we know at the end of the day how they function. We know that we are making that very nice marriage between fellow and need at the organizational level, so that we don't have the mismatch that in the earlier years could occur, and that was always frustrating both for the NGO partner and for us. So we've really tried to hone it in and think of it as an application process, and then a 2-year commitment, and that does evolve every 2 years.
Great. And for us, we knew what our main objective was. We really wanted to find new and better ways to improve health globally. And so knowing that objective, we then looked at potential partners. And really, Ashoka rose to the top. They had a long history of finding really good social entrepreneurs. We knew that they could bring quality fellows to us. So that was really what it came down to, is just really finding a match to who we were, what's in our DNA as a company, and finding a partner that shares sort of those same characteristics. And that's how we arrived at Ashoka.
So as I mentioned, we have a rather large program, and the only way that we would be able to have this program run so successfully is through our partnership with our 3 NGO partners, and CDC Development Solution is a very, very important partner to us. And so it's a little bit of a recipe of working very closely with our NGO partner to help us source the projects and the organizations that we're working with on the ground. We also feel very strongly about the value of public-private partnerships, and so we have a number of different partnerships in the public sector that we work with to come up with kind of the best use of our resources and to help further some major public projects. And then we also work with some of our IBM clients in terms of thinking of ways that we can come together and bring our respective skill sets to a particular problem. And then lastly, the IBMers on the ground in the countries that we're working with are an important part of the process in terms of helping us to identify the types of organizations that we should be working with.
Thank you. Mary Beth, since your program is a little bit newer, can you talk to us a little bit about your employee selection process? And you said you had some challenges at the beginning, so maybe how has that changed over the past couple of years?
So we have, the challenges we had in the beginning, again, were everyone kind of expected when we signed up with Ashoka that this would sort of be this volunteer for all type of opportunity. But really what we found is there's lots of opportunities for employees to raise their hand. So you've got the employees who raises their hand and says, I want to volunteer in some way. And we've created skills-based volunteer opportunities for them. And they actually sometimes tend to be shorter opportunities. We do this thing called a virtual hangout, which we've had great success with. And basically what that is we take a fellow, and for an hour they get on the phone with a group of employees, so more of like a team experience, and they sort of back and forth for an hour innovate and think. So the fellow will talk about what project they're working on, and an employee will sit and think about the project and then offer up ideas or questions. And really what we found is the employees that experience that then understand the value of it. And they also really feel empowered because they're like, wow, I'm really bringing value to this or to a fellow. So that has been one process. The other process that we've had is really the executive in residence, where we've identified emerging leaders and we've put them into a program for 6 months at a time. And I think Thomas will talk about that in a little while, but it's really enriching experiences. And that doesn't happen as often, right? That's a smaller pool of employees. But those we identify, and then we just created lots of opportunities for mentors and panelists for the employees that want to get involved, but in a smaller way.
Great. And Gina, you have 500 people on average a year who go.
Right.
So how do you manage that process?
It's a long process. It takes us about 6 months, but we really have it down pat at this point. The reason why it takes us so long is because we're very, very thorough. This is a program for the best and brightest of the company, and it's an extremely competitive program. And applications continue to rise year on year. So we have quite a robust internal process. We have an intranet, of course, being IBM, and an internal application site where employees apply, and they have to meet certain criteria in terms of their performance rating. They have to answer a number of essays and really demonstrate their commitment to community service and demonstrate the competencies that they would like to improve through this type of experience. And we also ask for their manager's approval and some commentary from their manager, so it's really a well-rounded application. And we have a number of reviewers around the world who are reviewing all of the applications.
And how about for Pfizer?
I think for Pfizer, we have 3 basic criteria. The colleagues need to have been at the company for 3 years, be strong performers. So equally, we think of this as a leadership tool, and have management endorsement. We have benefited from IBM's experience and have an online application process, but the actual application that the fellow goes through, they really go to the NGO partner. And just as we sort of put the NGO partner through a rigorous process, we then let them make the selection. And so it is like an interview, and they have to be considered, and we have at least multiple candidates by each partner, so they're able to make the final selection.
And your partnerships with your NGOs are so important to your program. How are you able to kind of measure success, both with them and then within the business?
For Pfizer, we traditionally focus as a research-based organization on impact and evaluation, and I think this has been a new area for us, but we measure it at the organizational level and at the individual level. We've been partners with Boston University throughout the course of the program, and they do evaluations for us. And what's terrific is we're able to assess the impact to the actual organization as well as to our individual fellows. And we do that through annual surveys. We also integrate the performance of the fellow into their annual performance review at Pfizer, which is a rigorous process. So we feed that information back in. And for the impact at the organizational level, that is done both through the surveys, but also through what case studies that we're able to see over time. Now that we work with partners for up to 2 years, we're able to see that impact tracked into the actual projects that the fellows have completed.
That's great. And we're actually lucky enough today to have a Pfizer fellow with us. Is Todd in the audience here? Todd, can you tell us a little bit about your fellowship experience and kind of maybe some of the learnings that you feel you were able to bring back to your day job at Pfizer?
Hello? Hello? All right, thank you very much. My name is Todds Experience. I work for Pfizer in their oncology business unit. And I was a Pfizer Global Health Fellow in 2011 with GBCHealth during their transition from the Global Business Coalition on HIV/AIDS, TB, and Malaria to GBCHealth, and that was wonderful. I actually worked with the Healthy Women, Healthy Economies initiative at the time, which really looked at building foundation for improving outcomes for women and girls in a global capacity. And I view myself as being competent and intelligent. I've been involved in the emergency medical services in the United States since 1998. I'm Deputy Commander of a Disaster Medical Team under Department of Health and Human Services for incidents of national significance. I have advanced degrees in public health and disease management and epidemiology, so I thought I'd be pretty prepared for this fellowship. And what I wasn't prepared for was the life-altering experience that I had at GBCHealth as a fellow for 6 months. And so for me, it permanently changed just the way I appreciate and perceive things, both personally and professionally at Pfizer and just even myself. I really learned and experienced the true benefits of diversity and synergistic teamwork. I learned how to work smarter, not necessarily harder. And that was a very key thing to learn. And also the real value of strategic decision making in order to promote sustainable change. It seems like everywhere, global health, corporations, you're really being asked to do more with less. And and it's certainly true at Pfizer as well. So that's been valuable, and all of these particular keys I've applied in my current work in the oncology business unit. And it's even been a career change for me. Before I went in this fellowship, I wanted to be in district or regional management. And as soon as I came back, I applied to an advanced degree program in pharmaceutical outcomes and policy. I now changed my complete career plan 180 degrees to go into global health economics and outcomes research. I want to contribute more on that level. I actually graduate from my graduate degree program next month, hopefully, if I pass the test. And then, one of the other things, too, is just become an advocate. It's really changed who I am. I get to speak at a lot of internal company meetings, and people learn a little bit more about global health and the need and urgency that's out there. And one of the colleagues, actually, I spoke to in the oncology division got so motivated, she actually applied last year, and she deployed last week to another global health fellow event. So, in summary, the global health program really made me a better, more productive, happier, and more engaged employee for Pfizer, but it's also just made me a better person overall. So, special thanks to Pfizer for allowing me to do this, and to GBCHealth, because I am not the same person that I was before I went on that fellowship. and I think I'm a much better person. So thank you. Thank you.
We're also actually lucky to have a volunteer from BI, Dr. Thomas Frank. So maybe you can talk a little bit about your experience in Argentina.
So good afternoon, everyone. Yes, my name is Tom Frank, and I work for Boehringer Ingelheim in Germany. And I'm an IS consultant, and I used to work with the marketing departments, mainly on global initiatives, global digital marketing activities. And I was selected in this global management development program, GMDP. We were a group of 11, and 6 of us were sent as executives in residence on one of these Ashoka projects within this Making More Health initiative. And I was lucky to be sent to a fellow in Argentina, to an organization that's called Fundación Educacional. And this organization is doing nutrition education for school children and also for their parents in order to prevent obesity and following up diseases. For me, it was quite challenging coming to this new place, to this new, completely out of my business experience place in a different culture, and working with no one you know in a new organization. So it's a pretty out of your comfort zone situation when you come to this new place. Interestingly, my job there was to help them to extend their outreach from working more in a local area around Buenos Aires to work all over Argentina. And so what I did was I was looking at the way they work, their figures, and we really looked at their business model and made a decision to change the business model and to introduce ways of communication technology to be able to reach out to much far away people and to extend their outreach in a lot. So when it comes to the question, what does it help? For the organization, I think it was interesting because they were really challenged in the things they were doing, and I could bring in a lot of the experience I have from different projects before to help them rethink and remodel what they do. On a personal level, it's definitely interesting because you really learn a culture and you learn how things work in a country when you live there. And that's very different from being just let's say as a guest in one of our operating units in a country where you are picked up at the hotel with the car, taken to the company, taken back by the car. I mean, you live there and you have your own apartment and you work there and all the things, and you really get deep down into it. And when I think about it now, it's the opposite way around of what we usually look like at markets or countries. When we think about markets, we usually look top down and we take market research. And this is the opposite way around. You know, when you're working there in this country with the people, the children, this opportunity, you really look at bottom up and you get a completely different view on what's happening. And then when you ask, so what's the outcome for BI? I think it's very similar to what you said. It's probably a really high motivated employee who comes back and who brings in a lot of cultural experience and knowledge, and also a lot of knowledge what happened in this country, and also somebody who was able to get a lot of learnings and to experiment a lot while he was in this sandbox-like environment there.
Great, thank you. Well, we definitely want to make sure to have some time for questions from the audience, and while we're kind of preparing for that, Gina, your program, their programs are both kind of 3 to 6 months in duration, and IBM's is only 4 weeks. And then on top of that, you're not a healthcare company specifically. So
Right.
Can you just tell us a little bit about kind of how the 4-week program works and why IBM is committed to healthcare programs?
Sure. So to answer the last part of that question, why wouldn't we be? Healthcare is an extremely important issue for us. IBM very strongly believes in our commitment to the communities that we're living and working in, and corporate responsibility is critical to everything that we do. So healthcare is certainly something that's very important to us. It's also an important business initiative as part of our Smarter Planet strategy, and we have a number of different activities that we do in the area of healthcare. So to answer the question of what the heck can you accomplish in 4 weeks, we sum it up by saying, you know, it's oftentimes being a catalyst for change. It's as I said before, it's a team-based program, and it's a matter of bringing in a team of people who are looking at a particular issue And sometimes it's a matter of bringing visibility for whatever that particular organization is working on. As I mentioned before, we also strongly believe in public-private partnerships. And for example, some of the work that we've done in the area of healthcare is we're sending our second team to be working with PEPFAR in Kenya, working specifically on the extension of the program to cervical cancer screening and care for women in Kenya. And originally, you know, the CDC did kind of scratch their heads and say, well, what could you accomplish in 4 weeks? And we sent a team last year. And at the end of it, they were really pleasantly surprised at how much of an impact our participants could bring in terms of looking at how, providing recommendations for creating a better flow of information. There is a lot of really terrific work going on, but the information is not flowing as well as it could be from the clinics to the Center of Excellence. And so that's an example of how in a 4-week time frame, our participants really can put together solid recommendations on how technology can improve the flow of information. That's just one example, but I would leave you with the thought of really how we can be a catalyst for change.
Great, thank you. Are there any audience questions? Back over here.
Hi, David Greeley from Accordia. I was just curious, in your various programs, who pays for them? Is there a combination of the recipient organization, your companies, the individual? And I guess this wouldn't be relevant for short term, but for longer term, does the individual fellow take a different pay scale when they go out?
So for Pfizer, the colleague is paid their same salary while they are on assignment. We do make grants to our partner organizations to help them support the integration of that person into the organization. We think that's critically important. I think David knows that he's a great partner of ours on the ground in the IDI in Uganda. But for us, we absolutely have a budget that's a part of our social investment strategy for the company, and we use that hopefully effectively with our NGO partners and with CDS to do the type of work we're now doing on the pilots. But for the fellow, they take all the same benefits. So it's as if they're working at Pfizer.
Same for BI.
Yeah, and I've specifically not called them volunteers because they're not volunteers. They're fully paid by the corporation while they're on their assignment.
Yeah, we have some trouble with the word volunteer, but we have yet to find another word. So I guess we need to do some wordsmithing here. Maybe that can be our activity over cocktails this evening. For CDS in implementing these programs, we really believe it's important for there to be a little skin in the game on both sides. And obviously the contribution from the corporation is the talent that they're bringing to the table and sometimes a grant to help cover some costs. But we also ask for the local organization to provide a little something, and that could be something as simple as local transportation on a daily basis for the volunteer, or maybe lunch, or just a workspace. But we really want these things to be internalized, and so I think it helps for there to be a little bit of a cost associated. Speaking of partnerships, quickly, Vanessa, as you are working with the Peace Corps and sending your volunteers out, how do you see the relationships maybe with corporations evolving over time?
Is it on? Yep. Oh, it is on. Thanks. Hi. Thank you. I think one of the things about our model that we really like, and we designed it as a public-private partnership intentionally, because we thought there was a benefit to helping create this federal program, which we thought was very important, that there be an established sort of method of service in the country that way. But we also recognize that there is a big bureaucracy that comes with government, and it was important for us to stay very nimble and strategic. And so by being a 501c3 and having being able to be the private entity here, we have the flexibility to build partnerships in any way we need to really strengthen the program. And ultimately what the goal is to build better health systems, to train new doctors and nurses, and to really expand human resources for health. And we will create the partnerships we need to do that through whatever, through, we think, very smart mechanisms. Why we're partnering with Pfizer. Understanding what this program is going to do how many people we train, what the outcomes of that training are, is critical to making sure that we are always being as efficient and smart about our investments going forward. And the partnership with Pfizer is going to allow us to understand that. There are ample opportunities, I think, for and we hope to build private partners, because there's an opportunity for corporations to do medical devices that could bring these devices to the sites and expand the degree of care that we can give and improve the teaching tools that we have by that kind of in-kind donation. I think that these are, ultimately healthier populations are also stronger markets. And so I think that there is an interest for many organizations and private sector to be involved in this, because they will also have the ability to be invested in the places where hopefully, their services and products can be used. And I think that by thinking smartly about what those opportunities are, there's an ability for these organizations to partner with us, not only to build a stronger health system, but to be able to hopefully begin to understand where their services can be used. Am I talking too long? Probably.
No, you're doing Thank you. We have time for...
I was like, I could do this forever.
We have time for one more question from the audience, if there's one.
Hi, my name is Ochiko Keyamo, an Atlas Corps fellow from Nigeria. Yeah, and I'm currently serving at GBC Health. So I don't know if you've heard of Atlas Corps. Yeah, what they do, they bring non-profit leaders all over the world, especially in Africa, down to the US. So it's a reverse Peace Corps. That's what we normally say. I just want to ask a question. The lady in Peace Corps, I want to ask, what's your criteria for sending your fellows to these countries? How do you pick out these countries? How do you choose the countries to send your fellows to? That's my question.
I'm sure you all have different reasons. We have 2 Atlas Corps fellows at CDC Development Solutions, so I'm very familiar with your program. But how do you select the countries that you work in?
So as I said at the beginning, when we started, we really went by the partner and where they had the greatest presence and the greatest reach and where the epidemic of HIV/AIDS was greatest. Over time, we've identified need as well as importance to the company. So I do think in terms of marrying social and business impact, it's important to note that countries like Nigeria are critically important as growing economies, and so it makes good business sense to be in countries that both need healthcare infrastructure support, but also are growing global markets. So for us now, we are in China, India, and East Africa, likely to shift a bit and go into some West Africa work in the future. But we want to make sure we've got strong partnerships, obvious need, but also great opportunity. And so that's how we think about the geographic split.
And for us, we have 50 fellows across the world, so it's not necessarily focused on any particular countries. And really how we've done it is, where's their need? What are the fellows' ideas that are aligned with the business, but also aligned with the skill set of the employee that is interested in the opportunity, or that we've flagged to have the opportunity. So that's really how we do it.
Great.
And for us, it's very similarly, our citizenship strategy or corporate responsibility strategy is all about being at the intersection of business and society, which really makes our work very sustainable. And this is an example of how we are connected to our business strategy, because we select our locations working hand in hand with the business, identifying those markets which are tagged for growth. And so, for example, this year, we're sending teams to the first time to Angola, Ethiopia, Ukraine, what am I forgetting? It's been stuck in my head. Tunisia. So those are the countries that we're sending teams to for the first time this year. But the point is that we do work hand in hand with our business units to determine where we see the most growth potential.
Great. Well, thank you all very much. I'm sure that if anyone has any other questions, everyone will be happy to stick around for a few minutes and answer them. We got back on time, so I think we did a very good job. I'm very proud of us. So thank you all for joining us.